Hi, Mrs. Carter. Thank you for bringing your son in. I understand he's experiencing some complications of his sickle cell anemia. Sounds like it's a crisis going on. Um, you said he's been experiencing increased headaches, pain and swelling, or pain in the arms, no swelling, pain in the arms and legs. You said that he's having difficulty keeping up with his peers, less energy. I noticed he's a little looking a little jaundiced, a little in the eyes, and definitely felt a little. Felt his spleen upon palpitation. He did say he experienced some tenderness there, combined with the labs that are showing the Howell Jolly bodies, which is just showing that there's complications of vasoconstriction um, in the spleen, which could increase the size of the spleen. Definitely showing complication or crisis. Could be an infection of some other sort. Right now, we can't tell what the infection is. If there is an infection, it could just be the complication of his sickle cell crisis. So my recommendations would be, because of the symptoms he's experiencing and the issues going on with his spleen due to the sickle cell anemia, I would recommend that he go to the hospital, be admitted to the hospital. I'm thinking he's definitely going to need some IV fluids. He's definitely going to need some oxygen therapy that's going to help. Um, they'll be able to manage his pain. Hydroxyurea, I'm sure you're probably familiar with that. Definitely some IV to decrease his symptoms, try to decrease his pain. Um, do some more labs, find out if there is an infection. But like I said, having the IV hydroxyurea and the O2 therapy, coupled with some hydration, IV fluids, pain therapy, morphine if necessary, will help to decrease his symptoms. And maybe now he will have to change how he manages his hydroxyurea. He might have to come in for infusions or transfusions, blood transfusions, until he is stabilized, because we don't want to put him in a danger zone. And right now we're leaning towards that. So I would recommend that. There are some things that you can do as far as his diet is concerned. Because there's no cure, the only thing you can do is try to assist further to treat symptoms or alleviate or I guess reduce the risk of having those symptoms. And an increase in protein will definitely increase the energy levels. And like I said, changing or managing his treatments. There are some other treatments that you can consider, but I would think maybe the hydroxyurea, getting transfusions on a more consistent basis, to help manage that better, until he's stabilized. But I would recommend that he goes to the hospital for this particular incident, because I think his labs are just showing that we're in danger of having further damage to his spleen, causing further complications, and we don't want that to be an issue. So, as you know, this is his history. I'm sure you know, as a carrier yourself, um, that these were the possibilities with having a child. And so these are the things that we're going to do to try to manage these symptoms. Um, if there's anything further that you would like to discuss, we can do that. But the recommendation would be to definitely take him to the hospital. Um, There is another treatment, though, now that I'm thinking of it. If there is something that they have, it's called L-glutamine. That also can help to decrease, but hydroxyurea is the best known treatment for it. Again, it's not a cure, but it will definitely help to decrease his multiple episodes of going to the hospital. And like I said, maybe changing how he's getting the hydroxyurea and maybe blood transfusions so he's stabilized. Making sure he stays hydrated, making sure he has an increase in protein. You can increase the iron. It's not necessarily going to alleviate the problems, but it doesn't hurt. So, if there are any further questions, please feel free to ask. I'm always here if you need to call, but we will go ahead and refer him to be sent over to the hospital, and we will do some follow up. And you can contact me in the meantime if you have any questions while you're at the hospital. But those are my recommendations. Hopefully that I've brought you some relief with some of the information, and you know what to do as far as moving forward with next steps. Thank you for coming in.